Perfect. We can start now. Good afternoon, everyone. On behalf of the European Microfinance Platforms Action Group, from research to practice and back again, we welcome you to our webinar called Building a Bridge Between Financial Health and Financial Education. My name is Max Nino Sarasua, and I'm co-heading the Action Group together with my colleague, Davide Castellani. The Action Group aims to bring the latest research findings, best practices, and new technologies to practitioners in a language easily understood by all that will considerably increase the usefulness of research and contribute to improve the lives of the populations in developing countries served by financial sector. During 2020 and 2021, we conducted three main activities. We did our research digest, which we call it COVID-19 and the financial inclusion value chain. We conducted a sector survey, which identified the research needs of financial inclusion actors. And we also did a mapping exercise. From the survey, we found that digital financial education was one of the top areas of interest amongst the 68 organizations around the world that participated in our survey. So we believe that in the current global context of crisis, post-COVID, financial education becomes more critical in allowing low-income people to take informed decisions. But also we find that financial health is increasingly being adopted by several institutions from both developed and developing countries. So in the Action Group, we decided to undertake deeper work to better understand financial education and financial health in terms of definitions, measurements, and possible relationships between the two. So today we would like to present our preliminary work. Our consultants, Patricia Lopez and Waruguru Ituu, will present the work they have conducted. And we are very delighted to have Chiara Monticone, who is a senior policy analyst from the OECD, who will present some insights into financial education and financial health from the work they are doing at the OECD. So before we get started, please, if you have any questions, you have the Q&A section, or you can also place some comments in the chat, and we will have some time at the end of the webinar to try to respond as many questions as possible. So we will move now to my colleague, Patricia Lopez, who is going to start with the presentation.
Thank you, Max. As Max said, we started our research from formulating assumptions, research questions, and conceptual framework. We formulated assumptions that led to a need to have a better understanding of definitions, measures, and possible relationships between financial health and financial education, and construct a conceptual framework to have more clarity of this. Our assumptions are financial education is an input and financial health is an output. Better financial education leads to better financial health. Financial education and financial health depends on individuals' behavior. Financial literacy, financial knowledge, financial capability are financial education. Financial capability, financial security, and financial well-being are financial health. And also another assumption important here is there is a relationship between financial health and financial education. Our research questions go around the definitions, as Max said, definitions, measurement, and relationship. Our conceptual framework includes interrelationships between individuals' behaviors on finances. The next, please, Max. I will talk now about our methodology. Our research consisted of two sources of information, primary and secondary. For secondary information, we use literature review, and for primary information, we use interviews to informants of key institutions. In desk research on literature, we reviewed approximate 140 number of papers, academic and non-academics, reports, policy reports, white papers, websites, and other sources of data like the Global Index of the World Bank. To gather first-hand information, we interviewed key informants from lead institutions on financial health and financial education. We interviewed 6 specialists and got 2 feedback from the field. The key institutions interviewed were FSD, Kenya, Microsafe, UNCDF, CFI, OECD, FinSalud, BFA Global, Solid, and Financial Health Network. The next, please. Our definitions of financial health and financial education were constructed from our desk review and a complementary contribution from the key informants. Then, financial education is a process of providing knowledge, skills, attitudes, and behaviors to make informed decisions through unbiased information and instruction, in a sense that allow people to develop their skills and confidence to recognize risk and opportunities to improve their financial well-being. Financial health is a process that includes 4 important aspects of an individual's financial life: financial security, financial resilience, financial control, and financial freedom. It is a state in which an individual can meet current needs, absorb financial shocks, and pursue financial goals. Therefore, the key elements of each definitions are the following. Financial education is a process to increase knowledge, skills, experience, and confidence to make decisions about taking risk and opportunities to improve financial well-being over time. Financial health is a process to be in control, feel secure, be resilient, and have freedom to make financial choices and take opportunities to improve financial health or financial well-being over time. We found that both concepts share common aspects between them, like following a process to reach the ultimate goal consisting of financial well-being over time. The next, please. Now, I would like to ask Ituu, my colleague Ituu, to present question 1 and question 2 to get your perception about financial education and financial health relationships before we present what we think about the relationship between both concepts. Go ahead, Ituu.
Can we move to question 2, Ituu, please?
So we have the responses for both question 1 and question 2, Patty.
Thank you. Can we go to the slide number 7, please? The answers of can we go to the slide before? Numbers, yes. The answers of the first question is around 85% responded yes, and around 50% respond no. And in the second question, around 80% responded yes, and around 20% responded no. So we can notice that audience is considering that there is a kind of relationship between both concepts, financial health and financial education. Considering the results of the first question and the second questions, then we can start considering some kind of relationship between concepts. Then we confirm what we were looking for. We were looking for answers of these two questions. Is there a relationship between financial health and financial education? And what kind of relationship exists between both concepts? We found that financial, as you said, that financial education is related to financial knowledge, financial literacy, financial capability, and financial health. And financial health is related to financial well-being, financial security, and financial capability. We found that financial education is an input of financial health outcome in the following sense. Financial education yields improved financial literacy and better financial health or financial well-being, because financial literacy is reflected in the individual's behaviors and practices that yield financial well-being, considered as the long-term outcome of financial education. We also found the reverse relationship. It means that financial health is an input of financial education outcome in the following sense. Better financial health yield the need for financial education to improve people's financial assets. For instance, to be physically healthy, a person must engage in activities that promote physical fitness, such as proper diet, exercise, sleep, risk management, and access to medical treatment. Equating physical health to financial health, a person must adopt activities that promote financial fitness, such as income generation, risk and money management, prudent borrowing and investing, and access to professional guidance. But how do people maintain or improve their physical or financial health? This is a production process that requires continuous awareness, education, habituation, examination, and adjustment as a result of financial education. There are 3 elements to show the relationship between financial health as an input and financial education as an outcome. The first is awareness. While most people are born into a physically and financially healthy state, many people have to be aware that certain activities are required to maintain their health over a lifetime. In this sense, financial awareness helps people realize the need to enhance their abilities to manage their personal finance. The second is human capital. A specific human capital is required to ensure that people have the expertise they need to know what to do and how to do it. The third is habituation. People need the opportunity to practice financial skills to form habits that increase their possibility of performing well when it matters. Additionally, regular checkups with a financial health professional allow people the opportunity to make sure they are on the right path to financial fitness and provide guidance of how and where corrections need to happen. This may involve intervention to provide additional awareness, financial literacy, and motivation to practice. Thank you. We found in our desk review and key informants interviews that contextual factors matter for financial health and financial education results and measurement. We found a framework which include CBA-MI conceptual model, UNCDF conceptual model, and BFA global measurement framework. These models consider contextual factors such as life cycle, household conditions, and environmental aspect. For these institutions, financial health and financial education results are different depending on contextual factors. For instance, financial education results will be different in a high-income household integrated by a married man without children than in a low-income household headed by a single woman with a lot of children and dependents. Another example is a person living in a rural area without institution regulation compared to a person living in an urban area with regulated institutions. The results of financial health in both cases will be different because the probability of a person in a rural area being involved in fraud will be higher. Therefore, financial health and financial education should include contextual factors in their measurement. Can we go to the next, please? The indicators used to measure financial health and financial education are in the context of low-income people. Financial education indicators are related to financial knowledge, financial behavior, and financial attitudes. Financial health indicators are related to the ability to meet urgent needs, the ability to face unexpected and adverse events like illness or job loss, and the ability to achieve long-term goals like buying a home or having a comfortable retirement. The key elements in financial health indicators are related to cash flow, management, savings, investment, and credit. We found that financial health and financial education measurement should infer from the analysis of multiple indicators. And also, we found that financial education and financial health indicators should meet the following: should be simple and reflect local realities involving actions by local organizations and institutions to provide information to make decisions, be comparable over time and between countries for comparative evaluation and benchmarkings, should reflect a person's financial behavior, and provide a score for a person's overall financial health and financial education to provide a basis for understanding and identify factors that can lead people to financial behavior and financial capability, will be instrumental in raising awareness of insights at the base of the pyramid group's well-being. Financial health and financial indicators, such as some of the presented here, will increase their value as they are widely applied. Now, can we go to the next, please? Now, I would like to ask Ituu to present question 3 and question 4 to introduce the idea of consumer debt and whether debt should be considered as a financial health indicator.
We invite the audience to put their votes so we can move to the next one. Thank you.
Here are the results according to the audience.
Okay.
We'll move on to the next one.
Yes.
So this one, we're asking if debt should be considered as a factor to measure financial health.
Oh. Okay, results say that in the question 3, is consumer debt good or bad for low-income people? Around 80%, 88% of people consider that it is bad for low-income people, and around 22% consider that is good for low-income people. And in the question number 4, should debt be considered as a factor to measure financial health? All the audience consider that it should be yes instead of no. It means 100% of the audience consider that debt be considered as a factor to measure financial health. Then this confirms that financial debt and also financial health can be, debt can be a good measure for financial health. I would like now to ask Chiara to present her experience in measuring financial education, changes on financial education indicators over time, relationship between financial education and financial health, and how financial well-being is measured in the financial literacy survey. Now, Chiara will be talking about these measures of financial education, and also she will abort the relationship between financial education and financial health. Thank you, Chiara, to be sharing with us, and we will be listening to you.
Thank you very much, Patricia. Good afternoon, everyone. It's a pleasure to be here with you today. So I will spend some time to share some insights on the work that we are doing at OECD on financial education and financial well-being. You will notice that we call it financial well-being at OECD, not financial health, but it's not substantially different from what you've heard so far. So if I may ask the next slide, please. So in my discussion today, I will give you some introductory information. I will spend some time to discuss definitions of the various terms and concepts. I will also discuss the link between financial education and financial well-being and the work that we've done to measure financial literacy and financial well-being. And I will discuss the way forward, the plans that we have. You will need, I will repeat it again a few times in my intervention, but please keep in mind that this is very much work in progress. So I may not be able to give a full coverage of all the interlinkages between these concepts, but we are working on it. So if we have an opportunity to meet again in perhaps 1 year's time, maybe I will be able to tell you more. So if I may have the next slide, please. Before going into the real content of my intervention, I wanted just to mention that what I will talk about today is not really just the work of my colleagues and myself in the OECD Secretariat, but is really coming from the work of the OECD International Network on Financial Education. And I actually see some of our delegates in the audience, so it's really nice to see you. Thanks for joining. So the e-MFP is really a global network that goes much beyond OECD membership. It brings together public authorities, mostly central banks, ministries of finance, and financial regulators from all over the world. We have members from more than 130 countries, so it's not just OECD countries. And the members of this network, they get together to develop policy research and analysis, data collection, and develop policy instruments on topics related to financial education and literacy, of course. So the members of the network, they collect together financial literacy data. I will tell you more about this. We develop policy advice and guidance to support strategic frameworks to financial education, such as national strategies. We develop policy analysis and research on topics that are timely at a particular point in time, such as, and that of course have implications for financial education, such as the digitalization of finance, the emergence of sustainable finance, financial resilience, financial well-being, and so on. And we also develop work for specific target groups that may have specific financial education needs. And our work contributes to global fora, such as the G20 Global Partnership for Financial Inclusion, and we have a number of regional and technical assistance projects where we have the opportunity to work more closely with countries in a region or specific countries to support the development of their policies and programs. Next slide, please. So you may wonder why the OECD e-MFP started working on financial well-being at all. So, and in the next slide, you will see that this really stems from our key definitions that were developed in the OECD. These definitions are taken from OECD recommendations or high-level principles on these subject matters. And basically, since today we are really talking about definitions, let me go through the two most important definitions that we have in our work. So by financial education, we have two distinct definitions of financial education and financial literacy. By financial education, basically we mean the process of improving financial literacy, and financial literacy is the outcome of this process. And in both of these definitions, it's clearly stated that the ultimate goal of financial education and of having greater financial literacy is ultimately to improve individual financial well-being. So this is why over time, we also developed devoted part of our work to this topic. Next, please. Of course, so we recognize, or we expect, in a sense, that financial education and greater financial literacy would ultimately lead to greater individual financial well-being, but we, of course, recognize that this does not sit in isolation. There are a set of other policies that would also contribute to financial well-being, and most notably policies in the consumer finance space, such as financial inclusion and financial consumer protection, but also a wide range of other non-financial policies, economic and social policies, such as social security, education and health. All of these, of course, have a great impact ultimately on financial well-being and should not be forgotten. And it's also important to remind that we are well conscious that financial education, again, also contributes to the other policies that may impact on financial well-being, and especially in financial consumer protection. We can see education as part of financial consumer protection and also supporting greater financial inclusion. So just to say that we are well aware that this sits into a complex and interlinked policy space. Next, please. And so to address all these various issues over time, we published a number of reports. The work on the relationship and on the definition of financial education and financial well-being has not necessarily been linear over time. We have focused on certain topics more than others, depending on the specific context that we were living in. If you could click again, please. And this is why much of the work that we have is still in process, but I will try nevertheless to give you some insights on what we have. Next, please. So in 2019, the OECD published a first document that was trying to set up a framework on financial well-being. And as I said, more work has been going on in the meantime. So part of what is on this slide is published and part is still not published and still going through the revision and the discussions of INFA members. But basically, a working definition, as I said, not published yet, but a working definition that we are considering in terms of financial well-being is that individual financial well-being would refer to being in control, feeling secure, and having freedom about one's own current and future finances based on objective and subjective factors. So this, of course, resembles very much what Patricia has been telling us earlier. But I think that there are three main elements that are important to keep into consideration and that are somehow summarized in this definition, is that there are both objective and subjective elements to financial well-being. There is a recognition that there are objective elements like income, resources, and so on, that would make a difference in terms of individual financial well-being, but also subjective perceptions of the ability of people to be in control, to have freedom, and so on regarding their finances. Another element is that there is a recognition that there is both a present and future element to financial well-being. It's important both to consider the ability to manage finances day to day, but also to have the long-term perspective, especially in relationship to financial resilience, as this is a crucial component as well of financial well-being. And last but not least, as was also reminded by Patricia earlier, there is a range of contextual factors that are expected to make a big difference in individual levels of financial well-being. And these factors may differ across countries, of course, because countries can have different institutional settings that may affect the ability of people to improve their financial well-being. But they may differ, of course, across people within the same country, and they may differ within the same person over time across the life cycle. We may imagine that people at young ages or older ages and so on may face different opportunities, different constraints that would ultimately affect their financial well-being. Next, please. In recent years, as many of you, I guess as well, we have been focusing mostly on the financial resilience aspect of financial well-being. It was clear that this was a component of financial well-being, but as many other institutions did during the COVID period, the main focus was really on financial resilience. We also published a few reports on this. This was defined as the ability to resist, cope, and recover from negative financial shocks, or from financial shocks with negative financial consequences, if one wants to see it even more broadly. And the idea was that such financial resilience would depend on the availability of sufficient liquid resources, such as income and savings and so on. But not only, this could also be supported by other behaviors or situations in people's lives, such as the ability to manage credit wisely. Credit is not necessarily good or bad. I mean, it can offer opportunities for consumption smoothing as long as it doesn't lead to debt traps or over-indebtedness. Financial resilience also relies on the availability and the ability to use appropriately various insurance strategies or products or mechanisms, and also a general awareness and ability to avoid, to the extent possible, of course, financial fraud and scams. Next, please. So just to spend, since this was one of the main topics of the webinar, I also wanted to go a little bit deeper on what is the expected link between financial education or financial literacy and financial well-being. And of course, in the 2019 OECD framework on financial well-being, there is a clear recognition that this process is not immediate nor straightforward. Of course, it's not that one leads automatically to the other, but if financial education interventions want to really target financial well-being and improve it, then they should focus on a number of elements that are more likely to be conducive in the end to greater financial well-being, such as supporting short-term budgeting and keeping within a budget and having control over finances, but also developing, let's say, adequate or accurate saving and spending plans in order to have, to be able to face both short-term income fluctuations, but also to build wealth over time in order to be buffers to resist the shocks that we mentioned before. Be prepared for foreseeable future expenses or foreseeable future, not shocks, but events that happen in life related to, I don't know, paying for higher education, healthcare costs, or other life events that are quite foreseeable, but also taking up insurance in a good way, in an appropriate way to possibly face shocks that may be less foreseeable. And as I said, also having a wise management of credit. Next, please. As part of our work, we also spent quite some time to try to measure all these various concepts. Next, please. So measuring financial literacy is something that we've been doing for quite a long time, more or less since 2012. We have a questionnaire with a specific set of questions that measures financial literacy among individuals and members of the INFA network. More or less every 3 years, they get together and conduct coordinated measurement exercises of their adult populations. What is the main message of this graph? This is taken from the latest results that we have available that were collected around 2019, so pre-COVID. But the main message is that when we try to measure financial literacy, we really try to follow the definition that I mentioned before. And that is, we try to look at different components, including not just knowledge, but also behavior and attitudes that would be ultimately leading to greater financial literacy. And this, in a way, is basically the same as many other organizations may call financial capability and so on. So it's just an issue of terminology, but I just wanted to mention that the concept of financial literacy that we use is quite broad. Next, please. Click again, please. So the financial literacy survey that the INFA has developed, as I said, measures these 3 components, so behavior, knowledge, and attitudes. Behavior gets the biggest weight, in a sense, in the financial literacy score. This was intentional because we thought, and the members of the INFA thought, that this was the component that deserved more attention, the most important component. This looks at the variety of, let's say, financially literate behaviors, such as keeping track of money, paying bills on time, being an active saver, avoiding to borrow to make ends meet, shop around when choosing financial products, making informed financial choices based on independent advice, and so on. And then there is a set of financial knowledge questions that look at understanding of a series of basic concepts, such as simple and compound interest, inflation, time value of money, risk and return, risk diversification. And the questions on attitudes are mainly geared towards looking at the extent to which people have a long-term orientation in their attitudes. And the survey, click please, also looks at other related concepts that can be studied in relations to financial literacy, such as financial inclusion, financial resilience and well-being. There are a few new areas in the new toolkit that we developed in 2022. We'll explore a series of new issues related also to digital financial literacy, sustainable finance, and so on. Next, please. As I mentioned, the survey also allows to measure financial resilience. These are some pre-COVID data and results. I don't want to spend too much time on this. Next, please. This is also another indicator that we have in the survey on financial resilience. We look at both the ability to cope with unexpected expenses and unexpected income shocks. And next, please. And I also wanted to mention that in the 2020 survey results that we published a couple of years ago, we also included a series of questions or statements that would allow to have a preliminary indication of financial well-being. So this is based on a scale that was originally developed by the US Consumer Financial Protection Bureau. So they have a scale composed of 10 items to measure financial well-being. The INFE survey includes a shorter version of the scale with only 5 items. So in the 2020 report, we published the results based on this scale because the scale has been, let's say, well tested, at least in the US, and it's been used in a variety of other countries. So it's generally recognized as a good scale. At the same time, we are aware that there are a number of other questions or items in the survey, and especially in the 2022 version of the questionnaire, that would also potentially be interesting to look at financial well-being in a broader perspective, not just focusing on this short version of the scale. So in future iterations of this international comparison, we may decide to expand the set of financial well-being indicators. Next, please. So as I mentioned, a good part of this work is still work in progress. So I'm not able at this stage to go much deeper than what I've been saying today, but just to mention that the INFE is currently working at a concept note that would basically reconsider the 2019 framework in light of all the new work that has been done in the OECD, but also in countries over time to better define financial well-being, better define its components, and better discuss the role of policies in the consumer finance space in supporting it. At the same time, as I mentioned, where the members of the INFE are now conducting another financial literacy survey using a revised questionnaire. This survey, like the previous one, it integrates elements of financial resilience and financial well-being. So this will be a great opportunity to look again at those concepts, especially in a, I'm not saying post-COVID, but at least in a few years after the start of COVID, let's put it this way, to have a fresh look at this data, see if things have changed. And this may also give us an opportunity to look in a bit more coherent way at relationships between all these various concepts. So I can stop here, and of course I remain available if there are any questions. Thanks.
Thank you very much, Chiara. That has been a really great presentation, and it really contributes and complements the presentation that Patricia made. And we have some questions from the audience. But before I go to the questions, I would like to ask a question that we have been discussing in the action group with Patricia and Ituu as well. In terms of this relationship, or the relationship between these two concepts, right? I mean, financial education has been already for more than 2 decades working on the financial inclusion space. And a lot of institutions believe that financial education is an important tool to increase the capabilities of people to make these informed decisions, right? Especially now under the situation of climate change, poverty, and other crises. Seems like financial education is an important tool. On the other hand, there are other scholars that believe that financial education has been a waste of time and money, right? And so it's interesting to see these two contrasts. But we find that financial health, as I said in the beginning, is increasingly taking over, and a lot of institutions are adopting that concept to have this measurement at the output level to determine how well or not people are, right? So, but it seems like that there is a relationship between the two. So in terms of policy making, and I believe that this question can be a little bit difficult, but in terms of policy making, if institutions, could be private or public institutions, are interested in now measuring the financial health of the people, what would be a good policy making strategy to get to that point? If we know that financial education can be an input to financial health, but also there is an argument that financial education don't work or doesn't work. So how can achieve better financial health for those customers or people if we don't have what the main or more important inputs are to achieve that condition?
Wow, this is a simple question.
I know, sorry.
No, okay. I think there are many elements to the question, and perhaps I will try to address them separately. On the role of, so does financial education work or not? It depends. There are financial education interventions that work and financial education interventions that do not work, like many other interventions in many other areas. So the idea of the e-MFP and of much of the work that our members do is to try to evaluate the impact of these interventions in order to be able to focus on those that work or that are most cost effective in a sense. It's true that there is this argument that a lot of money is being spent on financial education and financial education doesn't work. I think what matters is whether the money spent on financial education is meant on interventions that ultimately work. So it's, I think it's a bit generic to just say it works or it doesn't, or money is well spent or not in a generic way. I think it depends on the interventions and how to improve financial health. As I said, we cannot expect financial education to do it all. Financial education can play a role, but I think everybody's well aware that it's not going to be the silver bullet. It needs to operate as a complement to other policies. There needs to be appropriate financial regulation so that people have access to safe and well-regulated financial products. There needs to be an appropriate financial consumer protection framework so that people can make safe choices, but have also the opportunity to experience, experiment, use new products that may be useful and addressing some particular needs that they may have and so on. And in this context, I think financial education is important because ultimately in the financial markets that we are living now, people have choice and we value this choice. We consider that it's good that people can make choices, but they also need to have the skills to be able to exercise this choice in a way that is conducive to their own financial well-being or health. So, and I don't think that other type of approaches, such as having, I don't know, complete default options or thinking that everything can just be regulated and addressed by regulation, I think it would still not address entirely the ultimate goal of pursuing financial well-being, because people still need to be able to exercise choice to address their own personal circumstances and needs. And to do that, they need to have the knowledge, the skills, the attitudes, and so on to be able to do so. So I think there remains a value in financial education. So I hope this addressed your question.
Yes, thank you very much, Chiara. And I know that wasn't a very easy question. I will take one or two questions from the audience. From Ivo Janik, we send regards to Ivo. He says, looking at the financial literacy levels charts makes me wonder how much exogenous to financial education factors such as consumer culture play a role.
Yes, of course, there are many factors that can affect financial literacy levels. Financial literacy levels vary by gender, age, income levels, education levels, and especially they vary a lot by socioeconomic backgrounds or opportunities that people may have had in life to learn and so on. And it's clear that I don't know exactly what the colleague defines as consumer culture, but definitely, let's say, the broad institutional framework that may differ between countries or regions, this certainly affects also levels of financial literacy. I think there was a study, an academic study done years ago that was showing that countries that have higher levels of countries where financial markets are more developed and where people are more engaged in buying stocks and shares directly, they have higher levels of financial literacy because they have greater direct experience. Or countries where levels of social security, let's say, replacement ratios provided by social security are very high and have been high for the last maybe 50 years. Then those countries tend to have perhaps lower levels of financial literacy because people never really had the need to manage their own pensions individually, for instance. So it's clear that there are many, many factors that can affect levels of financial literacy at an aggregate level, so, and not just financial education, of course.
Thank you, Chiara. I have another question from Hans Ram in the chat saying, what is the difference between behavior and attitudes regarding the measurement of financial literacy levels?
No, thanks. That's a good question. So, and I can appreciate that sometimes the difference can be a bit blurred in practice, but generally when we talk about attitudes, we talk about, I don't know, confidence, motivation to make decisions, a series of attitudes that would basically underpin financial behavior, while financial behavior is something observed, is something, it's an action that can be observed. And of course, we all realize that self-reported data may have limitations, but we aim to capture what people are actually doing and not just what they think. So I think this can be, in a very, very simplified way, the distinction.
I know it's a very, very thin line between those two concepts. Thank you very much. I will leave the other question probably for a person to probably contact you. But in terms of time, I would like to move now to wrapping up some of the takeaways from our webinar. And I will ask Patricia, she can tell us, you know, what are the main takeaways, and perhaps if we can, then I will invite also our audience to our next, you know, series of presentations. But over to you, Patty, to give us some takeaways. Thank you very much, Chiara. Patty, you're on mute.
Thank you. Thank you, Max. Thank you, Chiara, for your wonderful presentation. And as takeaways, I would like to say that financial health is related with control, freedom, resilience, and security. And financial education has to be with investment, and also it takes attitudes, behavior, experience, knowledge, skills, confidence, and habits. Both concepts, financial health and financial education, reflect financial capability people, the financial capability of persons. And also the ultimate goal is financial well-being, which has to be with subjective well-being, subjective perception of the financial personal finance. And also we found from the audience response that there is a relationship between financial health as an outcome, between financial health and financial education. Financial health can be perceived as an outcome and also as an input, and financial education can be perceived as an outcome and also as an input. The relationship we found that is not linear. There are some factors that influence to generate financial health outcomes and financial education outcomes. And finally, we found that debt should be an important indicator to measure financial health of low-income people. And the most important thing here is that indicators should reflect financial behavior and financial capability of people preference. Thank you.
Thank you, Patricia. Well, we have reached the end of our webinar. I would like to thank very much to Patricia, to Ituu, and Chiara for the really fantastic presentations and support in this webinar. We know that this is work in progress, as Chiara said, and this is our very first preliminary work in our action group about these two concepts or topics, and we will keep working on it. We are having more work, and our next session is going to be during the European Microfinance Week in Luxembourg. I'm pasting on the chat the link where you can find information about this event. It will run from the 16th to the 18th of November in Luxembourg. And we were going to present a session as well with more work about these definitions, measurements, and relationship between financial education and financial health. Our purpose is, or objective is to come up with some practical indicators and ways to invite institutions to measure the financial health and probably work more with financial education if we find or we believe that there is a strong link that can lead to improve the financial health, financial well-being of the financial services users. But again, thank you very much for joining our webinar. You have all the details of our action group. Please reach out, and hopefully we can see you in person in Luxembourg in a couple of weeks. So thank you very much, Patty, Ituu, and Chiara, and have a wonderful afternoon. Thank you.